Okay, so we're gonna go through your health history real quick. So are you having any dental pain or discomfort at this time? Have you ever had any complications associated with previous dental treatment? Okay. And when was the last date of your dental visit?
Probably 2019.
And you got bite wings and your piano from them. Do you have any swelling or sores in your mouth? Okay. Do you have dry mouth? Okay. And then how stressful are dental appointments for you? Okay. And then what part of those appointments cause you some stress? Okay, so hearing those screams. Alright, so we're gonna probably, when you start your cleaning, we're probably gonna put some headphones in just to like block that out. And then are you under a physician's care now or within the last 2 years? Have you regularly see your doctor? Okay. So go ahead and make a referral for that. And then do you know the date of your last physical examination?
April 2021.
Okay. And then have you ever had a major operation or been hospitalized?
Yes.
Okay. And what for?
The operation was putting tubes there.
Okay.
The hospitalization was for an asthma attack.
Okay. And what year was that in?
Asthma attack. 2013.
Okay.
2011, something in that range.
Okay. And do you know what they treated you with?
Just a nebulizer treatment. And prednisone.
Okay. And then when were those tubes put in your ears?
Probably early 2000s, and then taken out in 8th grade, 7th grade, so
2011?
yeah, 2011.
Okay. And then, have you ever had a serious head or neck injury? Have you ever taken fen-phen or Redux? Have you ever taken Fosamax, Beniva, Acetal, or any other medications containing bisphosphonates? Are you on a special diet? Okay, and then do you eat a well-balanced diet?
Probably not the best.
Okay. What are we eating on a daily basis?
A lot of meat and like carbs, bread.
Okay. Any fast food at all?
I don't have time to make lunch.
Okay. Right. No worries, a burger won't hurt you. Have you experienced any recent weight changes?
Not really.
Okay. Do you have any issues with frequent urination?
No.
Do you have any swollen glands in your neck?
No.
Do you use tobacco? Do you use marijuana?
Nope.
Any controlled substances? And then is there anything you may feel may cause you to be more at risk for infectious diseases? No. Okay. And then are you allergic to any of the following? We have metal marked for you. And what type of metal are you allergic to? Nickel. Okay. And then what's your reaction to nickel? Do you get like a rash or?
Yeah, I get a small rash.
Okay. Do you use anything to treat that when it happens?
Some cream.
A cream. Okay. Probably just like a cortisone cream.
Yeah.
Okay. And then are you now taking or have taken any of the following medications in the past 12 years? Antibiotics or sulfa drugs, anticoagulants, uh, corticosteroids, insulin or other diabetic drugs, nitroglycerin, pain medication, prescription medication, and then what prescription medication are you taking?
Symbicort for asthma.
Okay.
And then there's prednisone.
Prednisone.
And then
Prednisone. And what is the benchmark for?
it's just my emergency inhaler.
Okay, and then any herbal or vitamin or dietary supplements?
It's a multivitamin.
Okay. And do you take that twice daily?
Yeah.
Okay. And then any over-the-counter medication?
Zyrtec.
Okay. And that was for the pet allergies?
Yeah.
Okay. That's once a day?
Yes.
Okay, perfect. Alright, so we have asthma marked for you. We also mentioned that your last asthma attack was in 2011 and 2003, and they used prednisone for treatment. Is there anything that like causes your asthma, any like triggers at all?
Pet allergies can, but usually it's just seasonal, hot and cold, and then get cold.
Okay, so pet dander and seasonal allergies.
Or like seasonal, like weather change.
Okay. And then we also have tonsillitis marked on here. So when was your tonsillitis? Okay, so 2005?
Yeah.
Okay. And were there any complications with that? Okay. And then we have seasonal allergies marked on there. And is that in the springtime or fall or both? Okay. And then what are your symptoms?
Just runny nose.
Any watery eyes or anything? Okay.
Yeah, water nose.
And then you said you take Zyrtec for that? Okay. Alright, and then what is your current height?
Height?
Yes. Okay. And your current weight?
240, 230.
Okay. And then we did your blood pressure, and that was within normal limits. We did your temperature, that was 96.5. You have a pulse of 66 and a respiration of 12. So we're going to put you at ASA due to that seasonal allergies and the asthma. So we'll definitely make a referral for a physician to make sure that that's controlled. So after watching my health history video with my ASA2 patient, I definitely wanted to reflect a little bit on what went well and some things I want to improve upon. So I definitely came into it in a professional demeanor, looked very professional, tried to make my patient feel as comfortable as possible talking about his health history, as there can be some touchy subjects in it. I feel like I definitely asked some good questions as far as probing questions because he does have asthma. I made sure to ask about the medications he's taking, whether that was prednisone. I also made sure to ask like what are his triggers, and he explained that it was pet allergies and like seasonal change. So just to make sure like there weren't any triggers that could potentially happen in the office. I also made sure to ask for when his last asthma attack was, just to make sure that it hasn't been any time recently that we need to be concerned about. And overall, I think I did a pretty good job about that. The only thing that I would want to improve upon is asking if he had brought his inhaler to the clinic that day, just in case of an emergency situation. We would, know exactly where that is and be able to treat him with his own inhaler. But thankfully, we do have in the emergency kit an inhaler, but it's just good to know, just in case something does happen in the clinic, that we're prepared and ready to treat the patient. So another thing I do want to work on improving is just taking the time to explain like procedures and why we're asking these questions, just because I feel like a lot of the time, like, patients are just like left wondering, like, well, why do you need to know this? Because I mean, we are touching on specific subjects that can be kind of hard to talk about, but just like letting them understand, like, as healthcare providers, like, this is the necessary information we have to know, like, to give you the best form of treatment. So just taking the time to explain why we're asking what we're asking. So I did also make sure to include a physician's referral, as it's been more than 2 years since he's seen a doctor. I think this is really important because he does have this condition, and it's important to consult with another doctor to make sure that his condition is controlled and that he's getting regular checkups on it. I did talk to him a little bit further afterwards about how strict he's being with his medications, and he did explain that he's been taking it every day and always has an inhaler on him. So it was great to have that reassurance that, like, he is doing the necessary steps to treat his condition. But again, yeah, we definitely wanted to get a referral for him so he gets regular checkups and physicals to make sure he's all healthy and good. So overall, I think this assignment was really beneficial, as I was able to practice those rapport building skills and discuss more sensitive subjects with patients. I was also able to really, like, dive into applying the knowledge from pharmacology into this, and be able to say, like, if patients are taking specific medications, what this how this affects their dental treatment, and how they're gonna respond to probing if that increases bleeding. So it's just really cool to be able to apply what I've learned from the program and put it into practice. So